All right, let's dive right in. Today we're talking about something pretty amazing, unlocking your body's own power to heal itself. We're going to get into platelet-rich plasma therapy. You've probably heard it called PRP, which is a really fascinating, non-surgical way to deal with that nagging knee pain. I mean, think about it. If you've ever had to turn down a hike, or you can't play with your kids the way you want to, or you just, you dread the stairs, you get how much that pain can take over. It often feels like you're caught between options that don't last and the idea of a major surgery. But what if there was something else? An option that doesn't involve surgery, but instead it taps into the natural repair kit your body already has built right in. Well, that's exactly where PRP comes into the picture. So what in the world is PRP therapy? You've probably heard the name thrown around, but the name itself, platelet-rich plasma, actually gives you a pretty big clue as to how it all works. Okay, the most important thing to get is that PRP is made from your very own blood. There are no donor products, no synthetic stuff, it's all you. It's basically a super concentrated dose of your body's own platelets, and these little guys are packed with something called growth factors. Just think of them as the tiny managers of a construction crew, telling your cells exactly how to repair and rebuild damaged tissue right where it needs it most. And you might think this sounds really complex, but the process is actually surprisingly simple. It really just breaks down into 3 easy steps. First, they draw a little bit of your blood, just like any other blood test. Second, that blood goes into a centrifuge, which is just a machine that spins it really, really fast to separate everything out and get that concentrated dose of platelets. And finally, that golden liquid, the PRP, is carefully injected right into your knee joint. And that's it. But what happens after the injection? I mean, how does this stuff actually work once it's inside your knee? This is where the science gets really, really cool. Honestly, the best way to wrap your head around it is to think of your platelets as your body's own little paramedics. Anytime you have an injury, a cut, a scrape, or in this case, that chronic inflammation in your knee, the platelets are the very first ones to show up on the scene. And they don't just show up, they get straight to work. They release all those growth factors, which act like a big signal flare, calling other healing cells to come help out. They help manage the inflammation, they pitch in to rebuild damaged stuff like tendons and ligaments, and they just generally work to make the whole joint a healthier place. So by injecting a concentrated dose of them, we're basically sending in an elite special ops team to a crisis zone. Now, this isn't an overnight miracle cure. Healing takes time, and it happens in phases. For the first few days, you're probably going to feel some soreness. That's the inflammatory phase, where all those first responders are just getting started. Then, from about weeks 2 to 6, you get into the repair phase. This is where you might start to notice, hey, this is actually feeling better. And finally, from weeks 6 to 12, you're in the remodeling phase, where physical therapy really helps you build back that strength and tolerance. Okay, so this all sounds pretty promising, right? But the next logical question is, who is this actually for? PRP isn't a silver bullet for every single knee problem out there, so it's really important to know who tends to benefit the most. So who are the ideal folks for this? Well, PRP works best when the knee still has some good healing potential left. It can be super effective for mild to moderate osteoarthritis, those chronic tendon issues that just won't go away, or persistent pain from just overdoing it. On the flip side, it's less likely to help with severe bone-on-bone arthritis, or if you have other things going on like an active infection or you're on strong blood thinners. All right, so let's say you're a good candidate and you decide to move forward with it. What does that road to recovery actually look like? What should you expect? The potential rewards here are really practical quality of life improvements. We're talking about just less pain day to day, being able to walk or climb stairs a bit easier, having fewer of those awful flare-ups when you try to be active. For a lot of people, this means not having to rely so much on pain meds and maybe, just maybe, putting off a more invasive surgery for a long time. Now, the injection itself is really only half the equation. The recovery is an active process. So those first few days, yeah, you're going to rest. But then you gradually start to introduce gentle movement. Think cycling or swimming. By week 3, you'll probably start some targeted strengthening exercises. The really crucial thing to remember is that movement isn't something to avoid. It's a strategic part of the healing. The key is pretty simple. Follow your rehab plan and listen to what your body is telling you. Don't try to be a hero and rush back into high-impact stuff, and don't ignore warning signs like sharp pain. Oh, and here's a really important one. Avoid anti-inflammatory meds like ibuprofen unless your doctor tells you to. Why? Because they can actually interfere with that initial healing process that PRP is designed to kick off. Now, with any medical procedure, you've always got to weigh the potential rewards against any potential risks. So let's take a balanced look. Here's the good news. Because PRP uses your own blood, the risks are actually very, very low. Most of the side effects people experience are not only mild, but they're also super short-lived. We're talking they're usually gone within 1 to 3 days. So what can you expect? You'll probably have some soreness, some warmth, maybe a little swelling right at the injection site, which, believe it or not, is actually a good sign that the healing process has been activated. A little bruising is also totally common. These are all completely normal reactions. And what about the time commitment? Well, for most knee conditions, the treatment plan usually involves somewhere between 1 and 3 injection sessions, and they're typically spaced about 2 to 4 weeks apart. This gives your body time to respond and heal between each treatment. So when you put it all together, PRP really stands out as this powerful middle ground. It's way more proactive than just resting and taking pills, but it's so much less invasive than surgery. It's a way to actively help your body repair itself while you're working on getting that strength and stability back. Which kind of leaves us with this final, really fascinating question. As we learn more and more about the body's incredible ability to heal itself, it makes you wonder, for a lot of conditions, could the most powerful medicine we have already be flowing right inside our own veins? It's definitely something to think about and to discuss with your doctor. Thanks for watching.